we just need to acknowledge we're waiting for the leader to join us.
Yeah.
And here he is.
Ah, spot on. Excellent. So we're all here.
Welcome, Dave. We've started broadcasting already, so we're currently live. We were just waiting for you to join us before we start the meeting. So over to you, leader. And you're on mute, leader.
Thank you, John. My apologies to everyone. I had some technical connection difficulties, which I appear to have resolved, which is good. So looking at our agenda for this morning, the first item on the agenda is the minutes to confirm that they're a true record. Are members happy with that?
Yep, absolutely.
Nods of approval. Yes, that's good. Thank you. Have members any declarations of interest that we need to highlight at this stage?
None from me.
No, thank you very much. I should just mention that Councillor Mosdell, due to some personal circumstances, isn't able to be with us this morning, and Councillor Brading, who will ably stand in her stead, so that we've got a quorum member, which is good. I've then got public questions. I'm not aware of any public questions. I'm just checking with Jane probably to see if there's any come in.
There have been no public questions, leader.
Okay, we can then perhaps just in relation to the minutes, I noted a number of actions that perhaps we can deal with, and then we'll move on to Simon Bryant. The notes I made, we were going to just check out where we were with working with our care homes. Is anybody able to update us on that, please?
Chairman, if I may.
Yep.
If I may then, Simon, we've had a very good, we're in regular contact with all of our care homes. We ring them every week. They feel like the last information I had was that they felt very supported. There's over 104 different care providers that we are talking to every week. And so far, I think we're getting very good feedback and they're getting all the support they need. So at the moment, I think we're in a good place with them. I'm sure Simon might want to add anything to that.
Yeah, just to say, absolutely echo what John's saying. We're in a very good place, and also as soon as there are any cases that need dealing with, we're working very closely with Public Health England and the care home to ensure that that doesn't spread any further, and that's really a positive relationship, working very well.
Absolutely. Sorry, Chairman, and may I just add, I probably should have said it more clearly, but I think we have to say a huge thank you to all of our care homes and care providers for the way they're working with us. It really is a positive relationship, but a positive relationship requires two sides, and I know that we're getting I'm hearing some very positive feedback from how that sector is engaging with us and working with us, so I think we should give credit where it's due.
Thank you. I see Gary Peace has joined us as well now. The second sort of action point I picked up was the work with schools, so that's fortuitous that Paul is with us. Paul, I wonder if you could just talk about general work with schools in the COVID, but in particular the recent events that I know you're fully sighted on.
Yeah, thank you, Leader. Yes, there has been a spike in our schools reporting positive tests in the schools community. Since Friday morning, actually, we've had 10 cases. Each one has been dealt with very professionally by the school, Public Health England and the local authority. The advice that's given from Public Health England is very clear. Schools are really quick at getting the communication out. We're very careful with our language. We talk about the schools community. Disappointing when some of the stories on the media are saying it's an adult or a child. It's someone in the school community, which is the important thing. We wish them all the best. And all cases have been dealt with. It's normally as least people need to be self-isolating as possible, but everyone that does need to self-isolate will be. For example, there's rules like if they've been within 2 meters of someone for more than 15 minutes. There's a situation at Northwood at the moment where, thankfully, there wasn't the need to self-isolate anybody. The Public Health England's advice was very clear, very specific, and I thank all the staff at the school for the hard work they do in providing information to Public Health England and allow them to make the accurate assessments on who needs to self-isolate. And schools automatically switch to remote learning if they need to. So the education is continuing very professionally on the island, and I'm grateful to all the school staff and the pupils and the parents that are understanding and adapting to what we have to put in place to make the schools safe environments, and it's a great credit to the island. Thank you.
Excellent, Paul. Fortuitous you're on this, and that gives a very clear update and very reassuring. Then the other action area was communications, and I saw that that was broken into 3 aspects. There was the community letter. There was obviously the Isle of Wight radio messages, which we've continued consistently with. And then there was other comms. So probably Wendy, you may want to just give us a brief summary on that.
Leader, I think you'll find that the communications update is an agenda item further on your agenda.
I'll update you. You're absolutely right, Wendy. Okay, well, I'll leave that one till there. And does that include the resident feedback? That was the only other point I picked up from the minutes. And if not, do we have any progress on that aspect?
It will include some information on resident feedback, yes.
Excellent. Okay. Well, then I can now move on to item 4 on the agenda, which is the report of the local outbreak engagement board itself. And item A is an update on the current situation, and I would think this is an ideal location for Simon to come in and give us a précis, is it not?
Many thanks, Ida. With your permission, could I share a presentation that with the data in? Would that be okay?
Yes, that'd be good. Thank you.
Can you confirm that you can see that?
I can. That's good.
Yep. Yes.
Yes, Simon.
So, thank you very much. So this is a presentation around the latest data. There'll also be some updated information on some of the new developments in the last few days, which I hope will be helpful for the board. Just remember, this is sensitive information and it's used for the purposes of managing the pandemic. So in terms of infections, in the last 7 days, we've had 106 new cases and a rate of 74.8 per 100,000. That's a 7-day rate. That brings our total on the Isle of Wight to 770. That line down the middle here is the difference between pillar 1 test on the left and pillar 2 tests on the right, which came in on the 14th of July. And we can see that our numbers are increasing. And if you compare that to England, we also see that they're increasing too, but we're well behind that curve. But it's the general trend is what we should be mindful of, that our cases are increasing. So our case rate per 100,000 population has gone up. And our test positivity, so that's the percentage of tests that tested positive for coronavirus, was 2.6. And again, that has been increasing. Just worth giving kind of the weekly case rate, putting the Isle of Wight in context of Hampshire and the Isle of Wight, which is the area we work with our other partners. And you can see that Isle of Wight is there at 74.8, and you can see other areas of the patch are much higher. However, it's worth saying they are all going up in an upward direction. And then you can see this in a nice graph format. You can see those increases across our 4 upper tier local authorities that we work with, the Isle of Wight being the lower blue, dark blue line. Again, it's lower, but it is going up, so it's just worth remembering that trend. Worth just talking about hospitalisations, really key that we understand where we are with hospitalisations. We've seen an increase in October and from September, and you can see that with the little lines there showing the number of patients, and that's a rate of 5.07 per 100,000. It's a rate per hospital catchment, but helpfully for the Isle of Wight, the Isle of Wight hospital catchment mirrors the Isle of Wight boundaries. Obviously in different hospitals around the country that's not quite the same, but from our purposes it's really helpful, so we can see that and we monitor that to see where they're going. These 2 maps I think are really helpful in terms of where we are as a country, just to demonstrate why the Prime Minister brought in the national lockdown. And you can see week 43 there's quite a lot of red, and week 44 there's more red and darker orange, and you can see the Isle of Wight's gone from the light blue to the green. So you can see in all cases, all situations rather, all cases are going up. And that's why we have moved forward into more national restrictions. As I said, sorry, back to patients in hospital. Sorry, misalignment of the slides. You can see that increase across the whole country with people coming into hospital with COVID. This is the whole country, and we look at the southeast. Just really helpful to see that. And again with ventilation beds. So slight increase. You can see not at the levels we had previously, but again, it's worth just noting that. Finally, it's always worth looking at deaths, and we look at the Office of National Statistics deaths, and you can see, just to remind the board from previous, the red kind of burgundy bars are where COVID-19 is on the death certificate, and the grey ones are other deaths. The green lines are the average weekly deaths of 5 years. So currently we're below our average, and that's really positive. Previously, we had an excess death from both COVID and non-COVID diseases. So just to say that's where we are at this point in time with deaths. Leader, I was going to move on to testing and then a little bit about the vaccination, if that's helpful.
That's be very helpful, and we'll tick off one of my questions.
Perfect. I realise you've seen this before, always worth reminding, there are a number of pillars, as they call, for testing. So pillar 1, as I mentioned previously, is those taking place in hospitals and by Public Health England labs with a clinical need. Pillar 2 is that wider community testing programme, which includes the testing centre at New Close and every other testing kind of site in the community that is out there. We don't have any others in the Isle of Wight. Pillar 3 is the serology, to see if people have got antibodies. Really important for us to do this, to understand where the infection is spreading and how to manage it in the long term. And finally, we've got the national surveillance. Again, a really important piece of work for us, kind of a survey, as it were, a representative sample of the whole of the UK to see where the infection is going, and this is used really clearly. I think we saw that with Professor Whitty's presentation a couple of Saturdays ago now. So all those are in there. So the next slide, I'll be talking about pillar 2. There's a number of testing modalities that we have locally. I put the regional testing site, not so that people from the Isle of Wight think that's where I go, but that's our kind of hub site where all the tests are kind of coming from. So our hybrid site, as they like to call it, is on New Close Cricket Ground. We also have programmes for vulnerable adults, so we do care home weekly programmes and some other care settings if needed. Every school, as Councillor Brady mentioned, is managing their coronavirus well, and they also have a sample of test kits to use should they need them to test people who are going to struggle to get to the local test site. And they're being used very well and very effectively, and they can order more should they need them. And we've heard of a number of pilot programmes. So we've got the University of Southampton locally, we've got a salivary test programme. We've got the lateral flow test, again, the Prime Minister mentioned a couple of Saturdays ago. And then we've got the Lamport test and the Van Lab, which are less developed. The key thing for remembering these pilot programmes, it's really helpful for us to be able to test different populations. But I've just put that technical box there. We need to understand the sensitivity and the specificity, and what I mean by that is, does it pick up true positives and true negatives? And with the lateral flow test, it's very good at identifying if you're negative. If you're positive, you then need that confirmed by the usual pillar 2 test. Really helpful for us to understand that, and really can be helpful in different settings, but it's not the answer to everything. But it's great that that's coming on board, and we're looking at how we can use that on the Isle of Wight for particular settings and how we could roll that out. So that's really positive. That's still through the nasal swab, so it's still slightly invasive. Just worth saying why we're in lockdown and why the government put that in there. So it's the single most important action to fight coronavirus, to stay at home, and we're requiring people to stay at home except for specific purposes, prevent people gathering and closing certain businesses, and that's going to run until the 2nd of December. Finally, it's really worth talking about the vaccination programme, which has had a lot of exciting news this week, which is really positive. One of the most positive things we've heard around COVID since we've started. There's a population of over 18s planned to commence on the 1st of December. It will be a small scale programme at that point, but that's what's being planned for. We need to remember that won't be throughout the population for some months, so we'll need to continue to manage in the way we are, really doing some really good work that the island's doing and the island residents around their social distancing, hand hygiene, and I thank everyone for doing that. It's just worth saying there's 2 large-scale vaccine trials near completion. They're not yet licensed by the medical and health research agency, so we need to make sure we watch that. And when they do their analysis of that and they're deemed to be safe to roll out, we will then be rolling out a mass vaccination programme across Hampshire and Isle of Wight, including community vaccination sites on the Isle of Wight and mass vaccination sites. So they'll be rolled out, and the NHS is leading that programme. And there, this just shows a little bit more detail about that programme. But as it says there, the bottom but 19, there will be no deviation from the Joint Committee on Vaccinations and Immunisations guidance. So we'll be following that, and it says the uptake there, which is really positive. It's very, very positive, as it says, operation from December and rapidly scaling up in December and January over the next 6 to the rest of the year. So I think it's good news. We just need to bear in mind that actually we'll start to see that going through the population in the coming year. I will stop there, Leader, and happy to take any questions as helpful, and I will unshare my screen.
Okay. First of all, can I say thank you, Simon? That was very comprehensive, as it always is. Any questions from other board members?
Yep. Thank you, Leader. Just for confirmation, Simon, you mentioned that 2.8% tests were positive. Well, the good news on that, of course, is that therefore around about 97% of tests are negative. I'm assuming that 97% negative is a figure derived from all 4 of the testing regimes that you identified. And so, and I can see you're nodding, so thank you for that. Yeah, that assumption was right. First question is, if we are now going to be doing far more tests, as appears to be the case, might we expect that 97% negative to increase? I mean, that would be an assumption. So if you can give me a view on that. And the only other question I have is that, recalling at our last meeting, you were identifying that figures within certain age groups had accelerated more than others. Right at the beginning, we had seen the very elderly getting the problems, but I believe last time we had identified that lower age groups from around about 21 plus had now. So the second question, is that still the case?
Thank you very much for that question. So with regard to your first question, just to confirm, yes, if the positivity covers all tests taking place, so that confirms that. What we want to do with testing is ensure that should you need a test because you've got symptoms of coronavirus, which are, the high temperature, persistent cough or loss of smell or taste, that you can easily access a test. So we still want to test the right people. And what we're doing with these different tests is making sure we can do that. Some of these tests, including the lateral flow, may be suitable for on asymptomatic people in certain situations. So you're right, we might see that the positivity rate comes down, which is really good. So that means we're for us, the more people we can test with the symptoms or in certain situations such as asymptomatic, and that positivity comes down, and that's good for us. If it goes up, it means we've got more coronavirus circling in the community, and therefore we may need to take different actions. Yep. So that's helpful.
Yep.
With regard to the age groups, Councillor Braden, do you want me to carry on and come back to you?
Yes, please do. I just had a specific question for a minute, if that's all right.
With regard to the age groups, you're absolutely right. We've seen it in the younger age groups, and then we've seen it as the infection spreading through our community, that age increases. So more older people are getting it, and we then we know that the older people are more likely to suffer worse impacts, so therefore need further care. I think what we've seen, I can give my understanding of the northwest of England, is that they've seen their cases drop off in that younger age group now and still going up in the older age group. But at the minute on the Isle of Wight, we're in a place where it's going up and it's in the younger age group, but the average age of those infected is going up.
Right.
Councillor, you're muted.
Yeah, sorry, Councillor Paul Brady, did you say you had a question?
Thank you, Lee. Just a quick question for Simon, really. I don't know if this sort of this level of data is available, but is it possible, or is there data that would show the number of school-age children that have actually been tested against the number of school-age children that have actually had a positive outcome? So I'm assuming now that obviously more pupils are being tested. Don't data goes down that far in breaking it down.
We look at all sorts of data, including that positivity rate in different age groups. We kind of saying school age pupils is probably a bit more challenging, but we look at younger people in the broad main and see actually we can see the difference in those age groups. As you said previously, the schools have done really well in terms of managing that and isolating children. So it's a good picture, but we know that we just need to understand what their positivity rate is and what the impact is. But we look at all sorts of different factors.
Thank you.
Thank you, Paul. I think the Chief Executive's got a question, and then I'll go to Gary Peace.
Yeah, thank you, Leader. Not so much a question, more a comment, really. And I think Simon has helpfully set out the current environment in which we are trying to work to both contain and recover from the virus. But I think he also points to some of the current challenges that we probably have to think about over the next 6 weeks. So the first one for me is, how do we ramp up arrangements for dishing out mass vaccinations, if you like, at the same time as we also need to step up arrangements for mass testing? So as a council, we're trying to support the CCG in terms of rolling out arrangements for mass vaccinations and preparing for that. But also we're being asked to prepare to do mass testing as well to help people. So that's one specific challenge that we're focusing on as an organisation at the moment. I think the second bit that we also need to focus on, and we're spending quite a bit of time on, and I'm sure Wendy will talk about this later, but the issue I think for the whole community is what happens when we come out of lockdown, when we come out of national lockdown. So coming out of national lockdown, we'll probably go back into a tiered structure, and we had tier 1, tier 2, tier 3 is the present arrangement, but that could be revised. And I very much hope that the results of the lockdown will mean that we come out as an island, we come back out in tier 1, because that will give us all of the freedoms and flexibilities to enjoy the things that we did before, we were doing before national lockdown, and not be subject to the same restrictions as, say, were applied to the Northeast and the Midlands. But we'll only do that if, as a community, we make the best of this period in time now to, follow all the rules, follow all the guidance, and make sure that we get ourselves as an organisation, as a community, into a position where we can come out at tier 1 and not at any higher particular level. So whilst there's a vaccination in the offing and whilst there's mass testing in the offing, there's still a huge ask of our community and the individuals in the community to follow all the guidance and help us get prepped for what happens at the end of national lockdown. And I think that really was my third point, was yes, it's really exciting, there's a vaccination out there and it's possible to come around, but we're still not clear yet about the time that it might take us to vaccinate the whole community. So yes, we'll start with the most vulnerable first, but it could take us till March. It might even take us a little bit longer to be able to do the whole community, but depending upon how things develop. So we shouldn't look at the fact there's a vaccination around the corner as an excuse to just relax and just go about our business as we did before. There is still a real challenge for us all to deal with whilst we put all those arrangements in place for that vaccination. Sorry, Chairman, I've said more than I wanted to, but hopefully that's a bit of a help and some of the things that we're considering at the moment.
I admire your enthusiasm in the morning. Simon, just one question which follows off the back of that. When will we receive the data on the impact of lockdown for the island?
Thank you, Leader. So we know that what's called non-pharmaceutical interventions, so those interventions in the community, such as the lockdown, take about 2 weeks to have an impact. So we need to monitor our data, and I know that nationally they're trying to wait as long as suitably possible before they make a decision about how to come out, as the Chief Executive said, so we understand which tier we come out in. But please be assured that we are monitoring data regularly to see what's happening, but it will take a couple of weeks.
Thank you very much. And I think, Gary, you had a question. Gary, please.
Yeah, thank you, Chair. Simon, my question is around the hospital. Have you any sense of how preparations are going for, I know our cases are low, but they are going up, but we have only got one hospital and it's not huge. So how are preparations going for the hospital to ramp up their provision?
So I know from my perspective, working with them through the various partnerships and emergency planning routes, the hospital is preparing well and worked well during the first wave, and working with colleagues across the NHS to prepare. I haven't got the details, but I do know from meetings I'm in that they are looking at the data and making sure they're very ready to take forward any action should they need to manage an increase in cases.
And obviously, coming off the back of that, my other concern is obviously those that will then get missed if the hospital goes into increased measures. Is the knock-on effect for people that then don't get treatments? Is there consideration being given to that? Because I know that's one of the huge things nationally, is all the people that have missed cancer treatments and so on and so forth. And I want to make sure that that is kept in mind.
You're absolutely right, Councillor Peace. One of the things that's different about this second wave is the NHS isn't actively sitting down its other services as it did previously in the first wave. They'll be monitoring that really carefully. They've done pieces of work to understand the impact of the first wave and those restrictions and what that had on treatment, so that they can then make sure that they maintain business as usual as much as possible. Bear in mind, each winter sometimes things do get delayed, but that's how they are taking that forward.
Okay, thank you.
Councillor Brading, and then I think Chief Exec, I'll come back, and I think Stuart. Yeah.
Thank you, Leader. Just coming back on a point the Chief Executive made, actually, I think the Isle of Wight, we fought hard to get a testing centre on the island, and the new close testing centre has been incredibly successful. I know there was troubles at the beginning where people from the mainland were coming across, and Isle of Wight people were going to the mainland. That all got addressed really quickly, and thank you to Simon and the team for doing that. There are always going to be issues. We did have this centre on the island, which was a great benefit. With the vaccines, there's a question that I would ask on behalf of the public, really. In the vaccines on the island, I assume islanders will get vaccinated on the island, not mainlanders, and islanders won't be sent to the mainland for vaccinations. So in other words, the vaccination on the island would just be contained for island people.
Absolutely, Councillor Brading. There'll be a vaccination rollout programme across the country and across the island, making sure it meets the island's needs.
Thank you.
Good to hear. Chief Exec, and then Stuart.
Yeah, thank you, Chairman. If I may, just to add to Simon's comment as well, that I think, as I understand the vaccination programme, the first part of it will be about roving deliveries. So that'll be to the housebound and care homes. So obviously that'll be island driven. And then the next bit will be around community sites, but it's been led by primary care. So it's been led by our GPs as they lead the flu vaccination. So therefore, they will be working with their patient lists to deliver to their patients, rather than, as Councillor Brading said, rather than to mainland people. So it will be very much about the people on the patient lists for the GPs. I think the only other point I wanted to make in response to Councillor Peace's question was Simon's very first graph, which looked at the number of cases from the start of the pandemic to now. If you get a chance to review that in slow time, what you see before the 14th of July is, I think our peak number of cases were about 65, 70, something along those lines on any single day. Before the 14th of July, they were all in the hospital. After the 14th of July, the results are for hospital tests and community tests. So actually what you're seeing there is we've got the same number of cases, but we know that we haven't got the same pressure on the hospital at the moment. Although there is identified usually a lag between as the cases pick up and then the impact on the hospital. It's usually a couple of weeks type of lag. So, but we are engaged very closely with the hospital through through the the Island Tactical Coordinating Group, and through our own Silver Management Group, to make sure that the hospital has the support it needs and that the hospital itself is plugged into the wider Hampshire and Isle of Wight independent care integrated care system, in order to make sure that mutual aid is available across the whole of the area, so all the hospitals are working jointly together to support each other. So I think we have got some good structures in place to help, and we've got some good arrangements in place, but clearly the challenge may be if the whole system gets overwhelmed, which is very much what we're trying to avoid with the messages we're putting out and the national lockdown. I'll stop there because I know Wendy might have a comment about the Island Tactical Group. Thank you.
Okay, before I go to Wendy, because I'll finish with Wendy and we'll move on to comms. Stuart, was there a particular question you wanted to raise or point?
You're muted, Stuart.
Thank you for that. Yes, so there's a couple of points arising from the information about the vaccine, and I absolutely agree with Simon. This is some of the best news we've had for months. We've heard that the current vaccine, the front runner, as I would guess it's called, is effective in preventing infection in 9 cases out of 10. And I appreciate, Simon, you may not know the answer to this. I'm just impressed by the depth of knowledge you have about all these issues, so I asked the question. Is that a similar result to other vaccines that we have? So, you know, is say a measles vaccine 90% effective? So that's a question about the percentages. And the second one, which is a worry, and we know this happens particularly with the coronavirus because we see mutation occurring in the sort of flu type viruses every year. And we've also seen a significant mutation which has infected millions of animals. And I presume if it can affect animals, it can go the other way. So that first question is about the percentages. And the second question is the vaccine still going to be effective because of the mutation capacity it has?
Simon?
Many thanks, Councillor Hutchinson. If I pick up those points. So vaccine effectiveness is obviously really key, and different vaccines will have different effectiveness. My understanding is that because it's 90% effective, it will be a 2-dose vaccine. So actually, excuse me, that would mean for the first kind of injection, you're like 90% likely to be protected. And if you do another one, that's another 90%. That takes you up to 99%. And then if we get the whole community vaccinated, that means that that little tiny percentage that it hasn't worked in are protected by herd immunity. So bringing all that together, that brings a really positive kind of outcome for the vaccine.
Brilliant.
With regard to animals, yes, we have seen, as you understand from the way this pandemic started, the virus jumping from animals to humans. We have seen, as you've alluded to in Denmark, jumping into mink animals and then mutating and jumping back into humans. So we're really mindful of that, and we work with our zoonoses colleagues, so our animal health colleagues, to really understand that, and we monitor these diseases in those animal populations. And in the UK, I think we've seen it jump from humans to animals, but not back again. So we're really mindful of that, and that's why it's really important to understand what the mutation is, and does that mean the vaccine is not effective, or it is, which is why they've done some mass culling in Denmark, because of the worry that actually it changed enough that we were worried about that jump back to humans.
Right.
Okay.
Thank you,
for that.
Simon.
Yeah, very, Simon, very informative. Wendy, if I pass over to you, you had a question, and then perhaps we can move on to the comms aspect.
Thank you, Leader. It was a comment and following on from the Chief Executive and Director of Public Health's commentary on the hospital issue. It was really to kind of provide some more assurance and comfort to members on the board that the Islands Tactical Coordination Group, which is a part of our local resilience forum structures and something that we are obliged to do in terms of our responsibilities under the Civil Contingencies Act, meets weekly. It's a multi-agency group across public sector agencies that operate on the island and private sectors that have a key role in delivery of infrastructure to the island. And part of its responsibility is to have a weekly update from all of those members around their red, amber, green approach in terms of their current staffing arrangements, their forecast for arrangements, and any pressures on their system. As of this week, there were no agencies on that group that reported anything other than green, and that would be part of the route through which we would highlight any operational difficulties that agencies were having on island.
Okay, that's really good and informative.
Yeah.
Shall we move now to the communication aspect of this?
Yeah. So this is a communications and engagement activity update for the period since the national restrictions were introduced. Yeah. And you'll appreciate that overall our approach is to ensure that we help the community understand the national restrictions, which were brought in on the 5th of November and due to move out of on the 2nd of December. And that will be about amplifying some of the key messages in those restrictions that Simon's already outlined in his slide, but alongside messages such as stay at home, avoid essential travel, etc. We continue to use our full range of channels to share communications and to engage stakeholders, and that includes a forward programme of radio sessions, both with yourself, Leader, but with other health professionals and colleagues from the NHS Trust and Primary Care Network. In terms of the communications activity directly related to COVID over the last couple of weeks, we've had a variety of announcements around our support for vulnerable islanders and the stand up of the community hubs and the work that they are providing. We've provided further guidance to groups and indeed covered activity in relation to Remembrance Sunday. We've had the launch of the COVID-19 support officers, and we've had a number of statements in relation to cases in schools, which has already been mentioned this morning. More recently, we've launched the business support grant information, which went live yesterday. Now, that is all on top of our general approach to communications under the banner of Keep the Island Safe, which is our kind of major campaign message. And that's about raising the profile of the national restrictions. And we're looking at how we can potentially introduce lived experience narrative to support that, asking people who are willing to give their story of how they've been impacted by COVID and what COVID has meant to them, to provide an island voice that we can use to amplify guidelines and emphasise some of the key messages coming out of government. Next week, our focus is really along continuing the information about clinically extremely vulnerable and support available to them, mental health activity and support that's available across the island. It's National Safeguarding Adults Week from the 16th of September, so we will be doing something around that as well. And we're starting to think about Christmas campaigns to be developed in preparation for the end of lockdown from the 2nd of December, and working with our economic regeneration team and our economic board to ensure that we make best use of the time we have before Christmas to support the island's economy. We're continuing work on the self-isolation toolkit, looking at top tips for how to deal with national restrictions and what people can do based in their own home. And of course, our preventative approach to messaging around hands, face, space, social mixing, testing, self-isolation and support and guidance signposting is an ongoing programme of work. In the next week, we'll see the residents mailing, which will land on every household's doorstep. And that's the letter from yourself and our ICP leader. And again, some very good general messaging in that about how to keep safe, not just through COVID, but thinking about flu and just generally keeping healthy over the winter. You mentioned in particular residents' feedback at the start of this meeting. Yes. So currently there are a range of contact points where residents can provide feedback. and those are both individual residents or businesses and economic activity related matters. But I think what we're trying to do at the moment is garner support for residents to be able to raise issues with their local members, to feed back into us, but more importantly, develop a more formal process through which residents can provide feedback. We're just testing how that could work at the moment, but I'm hopeful that by the beginning of next week, we'll have a process in place whereby any issues that residents have, whether they are about COVID compliance or COVID related matters in general, they can be provided with a single point of contact. And the outcome of that, if you like, will be us being able to use that feedback to inform COVID related matters and COVID related campaigns and engagement moving forward. And of course, obviously, those issues that are raised can be brought back to this board for consideration in terms of how we put out local messaging around COVID related points. I think looking forward, there are some matters that we need to have on the horizon and think about messaging for, one of which is the return of university students over Christmas. And whilst the activity in relation to that sits very clearly with universities in terms of working with students, there will clearly be students coming back to the island, so there will be some messaging around that. We've talked a lot about vaccination and testing on island as well this morning. So as that evolves and develops, there will be messaging and campaigns around those to build. I think the one thing that we do need to bear in mind, and we've sort of touched on it this morning, and Jonathan Van Tam in his government briefing yesterday morning made it very clear that we are still dealing with wave 2. And whilst vaccination and additional testing is coming forward, those are not the solutions to wave 2. We are very much still in a situation where we individually can do as much as we can to keep ourselves and our communities safe. And I think that links very nicely to the information that the Chief Exec was giving you about what happens at the end of November and coming out of lockdown. And that actually we do want to be in a low tier. We do have and will hopefully have by the end of the month still very low rates of infection, but that we want the freedoms that being in a low tier provide. And some of the best things that we can do to ensure that we retain those freedoms is to continue with the good work that the community is doing in terms of social distancing, in terms of hands, face and space, and really thinking about how we're mixing with our friends and our colleagues outside of the home and outdoors, because it's those sorts of issues and that sort of mixing of households and mixing socially that we need to be careful about in terms of the community spread of infection. And I think that's my roundup on communications for you. Thank you.
Thank you. I got one other area of discussion because you've covered the other one in your comprehensive summary there, which particularly related to the business grants and support of business. We've made public our views about the ferry and their changes to services, etc. I think from this board's perspective, it's just to reassure ourselves and more importantly the public that the essential travel that people may need for treatment off island is still being maintained at a time when we know the normal services of the ferries, for their reasons, they are reducing. Are you able to help with that at all?
Thank you, Leader. You've raised a really good point. So we know that the ferry operators individually have made their own business decisions about their service provision. We have been engaged with them to understand what their response to this recent round of national restrictions was going to be. And we have been working with our colleagues in other public services, health, police, fire, to understand our own demands and needs, both in terms of staff movements, patient movements, goods and services movements, of foot passenger services in particular, and to put a case to DfT to help them understand why maintaining services for the island is critical, and that should we need to, if we don't come out of national restrictions in December, or if something else happens and the ferry companies wish to make further reductions, that we can have a conversation with them about securing services in the most appropriate way, and that DfT will intervene to provide that assistance to operators.
Thank you. I wanted to cover that point because I think it will be of concern to people, and I know a lot of work has gone on that. So I'm just really, I think we've covered all the items on the agenda. I'm just sorry, Stuart, do you want to comment?
Well, arising from Wendy's comments about the economic aspects, obviously we were told only literally a week or so ago that government was providing more discretionary funding for us, and we were at that time waiting for guidance as to what level of discretion we had in that additional funding. So one is a question and one is an ask. The first one is to say, have we had that guidance, and if so, is it similar to the last time or is it different? And the second one is an ask, which is to say that quite properly here we're focusing on the public health aspects first, but the economic aspects are as important. So it would be useful for us to have at our next formal meeting an update on the number and amount of money that we've given out in grant aid during this second, what we might call a containment phase.
Yeah, I think that's probably one of the few actions we can take forward from today. I think our next meeting is due to be on or about the 10th of December, which will take us beyond the current proposed end of lockdown. Yes. So I think you're absolutely right. I think we can see where we are there. We can see where we are in terms of our status within the tier system, if that comes back in at that time. And also we'll have probably 2 weeks we're thereabouts. We should have some data on how the lockdowns impacted on the island stats. So that's good. I don't think there's anything else on the agenda, colleagues. If we're happy, we've covered all our concerns at the moment. The chief exec's just coming in. He's a bit slow today because his equipment's not working quite as well, and I've told him to go back to the person responsible for setting it up. It turns out it's him anyway. So.
Yes, thank you, Chairman. I only want to make one more point, which I did want to make earlier and I forgot about, and I think Simon may come back on this because I think it's an important message that we share with our community. So I think the question was asked at a meeting I was at last night about, is there a pattern to the to where the infection is on the island? You know, can we point to a village, an estate, a region, an area? Because then I think when we originally talked about contained plans, we would say, well, we'd focus on that area and close things down. And I think the message that we really need to focus on is the fact that there isn't a pattern. You know, we can look at the data as it comes in, and it's a case there and a case here and a case there and a case there. There is no kind of linkage. So the only thing that's linking everything together is household transmissions, which is why we've got to the national lockdown case. So I think if we had a closing message to leave with our community, it is about, you know, hands, face, space are really, really important, but not mixing in households is the absolute key to getting us to the end of lockdown in a really healthy position for the island, so we can, you know, start to live our lives again as we were immediately pre-lockdown. So I think that's the one point I meant to mention but didn't. So thank you for giving me the time.
That's fine. Okay, thank you everybody. And we will publicly meet again at the next meeting, and in between now and then we will continue to carry on the good work that's clearly happening on behalf of the island. So thank you everybody for that, and we'll call the meeting to a close.
Thank you, Chairman.
Thank you, Chairman.
Thanks everybody.
Chair.
Bye bye.